This morning, did you use the bathroom? Most of us do without thinking twice. But what if I told you that a small automatic thing you did, just minutes ago, might have quietly increased your risk of stroke by over 300%? That's not exaggeration. It's a real, measurable danger. And it starts right there in the place you feel the most safe, your own bathroom. Every 40 seconds, someone in America suffers a stroke. Every 3.5 minutes, someone dies from it. But what if stroke risk isn't just about cholesterol, age, or genetics? What if it's also about how you breathe while wiping, how long you sit, how hydrated you are before your morning pee? Sounds ridiculous at first, but for seniors, especially those over 60, these tiny habits can create sudden pressure surges, disrupt brain oxygen, and trigger dangerous blood flow changes. You won't feel them. Not right away. But your arteries will. And one morning, they may not bounce back. The scariest part? Most doctors don't ask about these habits. Most people ignore them. Yet the science is now loud and clear. This isn't about scaring you. It's about showing you exactly where the danger hides and how to avoid it with a few simple tweaks. Because the truth is, the first room you visit each morning might be setting you up for a life-changing stroke. Now here's the part that really matters. Of all the habits we're about to reveal, one of them stands out. It's something almost every senior does, every single morning, without realizing it. It's not what you eat. It's not how much you sleep. It's what you do the moment you stand up in that bathroom. This one habit alone can send your blood pressure soaring by nearly 90 millimeters of mercury in seconds. That's enough to rupture a weakened artery in your brain. And it can happen in under 10 minutes. The worst part? It feels so normal, most people don't give it a second thought. So, if you're someone who's ever brushed off a dizzy spell, or told yourself, that's just aging, you need to hear what's coming. Because habit number one isn't just common, it's deadly. And you'll want to stay with us till the very end to make sure it's not something you're doing tomorrow morning. Your life, or the life of someone you love, could depend on it. So why are we talking about bathroom habits, of all things, when it comes to stroke? Because for years, stroke prevention has focused only on the usual suspects: cholesterol, salt, family history. Important, yes, but incomplete. We've been looking in the wrong direction, while the real trigger was right under our noses, or more accurately, right under our feet. You see, after age 60, your body works differently. Your blood vessels become stiffer, your circulation slows down, and tiny changes in pressure, things a younger body would shrug off, can now trigger something far more dangerous. The habits we're about to reveal might seem small, but together they create the perfect storm. Sudden surges in blood pressure, blocked oxygen flow to the brain, hidden inflammation in the arteries. And it all starts in the one room where you let your guard down completely. This isn't about fear. It's about awareness. Because the truth is, by learning just 7 small tweaks to your bathroom routine, you could lower your stroke risk dramatically, by as much as 60%, according to new studies. So instead of wondering, what if? You'll know exactly what to change, and why it matters. Let's get into the first habit. And remember, these are ranked from least dangerous to most deadly. Let's start with something simple: brushing your teeth. Most people brush once a day, usually in the morning. That sounds like enough, right? After all, your mouth feels clean. You're ready for the day. But here's what no one tells you. Brushing in the morning doesn't protect you during the most dangerous hours. When you sleep. At night, your mouth becomes a breeding ground for bacteria. Saliva production slows, giving harmful microbes the perfect chance to grow. And if you skip brushing before bed, that bacteria doesn't just sit in your mouth. It slips into your bloodstream, especially if your gums bleed or you have early signs of gum disease. And here's the problem. Over 50% of adults over 65 already have some form of gum disease. Once inside the blood, these bacteria don't stay quiet. They trigger inflammation in the arteries. They make your blood thicker, stickier, more prone to clot, and clots are the #1 cause of ischemic strokes. One major study published in the journal Stroke found that adults with gum disease were nearly twice as likely to suffer a stroke, even after accounting for smoking and age. Now, compare that to what happens when you brush twice a day, morning and night. You reduce plaque. You stop bacteria before it enters the bloodstream. You protect your arteries, not just your teeth. Better yet, switch to a toothpaste with stannous fluoride. Research shows it can lower key inflammation markers tied to stroke risk, like C-reactive protein, by over 40%. And don't forget your tongue. A thick coating can hold millions of bacteria. A tongue scraper removes almost 80% more than brushing alone. That's not just fresh breath. It's brain protection. So instead of thinking, "I'm too tired to brush tonight," ask this: is skipping 2 minutes now worth risking a lifetime of damage later? Brushing at night might seem like a small habit, but for your heart, your brain, and your future, it's one of the biggest decisions you can make each day. Now, let's talk about something almost everyone does, but no one talks about. You sit down on the toilet and you bring your phone with you. Just a few minutes, right? Scroll a little, read the news, maybe check your email. But here's what's really happening while you sit there. Your circulation slows, blood pools in your legs, the return flow to your heart and brain drops. For younger people, that's not ideal, but manageable. But for someone over 60, that simple habit can reduce brain blood flow by up to 17%, according to a study in neuroepidemiology. That's 17% less oxygen going to your brain. And if you already have narrowed arteries, that drop can be enough to tip you into dangerous territory. But it doesn't stop there. Scrolling your phone also activates your stress response, your sympathetic nervous system. Even if you're just reading headlines, your body reacts to screen time. Your heart rate increases. Your blood vessels tighten. Your blood pressure spikes. Now combine that with poor posture, head tilted down, neck bent. That position compresses the vertebral arteries, the very arteries that send blood to your brainstem and balance center. So you've got restricted blood flow from below, pressure building from mental stimulation, and squeezed vessels from bad posture. That's not just multitasking. That's a silent storm in your nervous system. Then what happens? You finish. You stand up too quickly. And suddenly, the low blood flow, high pressure, and rapid movement create a stroke trigger. So what's the better way? Instead of bringing your phone into the bathroom, leave it outside. Give your brain space to rest, not react. Instead of sitting for 10-15 minutes or more, limit your time to 5. Focus on the task, not the screen. And instead of standing up fast, move slowly. Breathe out as you rise. Give your body a chance to adjust. Because scrolling might seem harmless. But in the bathroom, it's not entertainment. It's a risk multiplier. There's nothing like a hot shower in the morning. It warms your joints, It soothes your back. It helps you feel human again after a long night. But if you're over 60 and you're not cooling down afterward, you could be doing more harm than good. Here's why. Hot water causes your blood vessels to dilate. That means they open wide. Your blood pressure drops. If you're on blood pressure medication, that drop can be even steeper. Now, when you step out of that steamy bathroom into cooler air, your vessels constrict suddenly. They tighten. Fast. That swing, from wide open to tightly closed, creates a bounce in your blood pressure. And that bounce puts enormous stress on your arteries. It's like pulling a rubber band too far. Again and again. A study from Finland found that older adults who took long, hot showers without a cool-down were twice as likely to suffer a morning stroke, especially within 30 minutes of stepping out. Why? Because that pressure swing can dislodge plaque, rupture weak vessel walls, or trigger clot formation. And if you're dehydrated, which many older adults are without realizing it, the risk goes even higher. Sweating in the shower might not be obvious, but it happens. And if you're not replacing that fluid, your blood gets thicker, more sluggish, more likely to clot. So what can you do instead? Don't skip the warm shower. It helps circulation and reduces stiffness. But always end with 30 seconds of cool or lukewarm water. This helps your blood vessels transition gradually. Less shock, less stress, and move while you shower. Gently shifting your weight or lifting each leg improves circulation. Don't just stand still under the water. Finally, have a towel or robe ready. Dry off quickly and keep your body warm as you transition out of the bathroom. Because instead of jolting your body with temperature swings, you're easing it through the change, protecting your blood vessels and your brain in the process. Let me ask you something. When you wake up in the morning, what's the first thing you do? If you're like most people, you head straight to the bathroom. But here's the thing. If you do that without drinking water first, you may be walking straight into a danger zone. Overnight, your body becomes dehydrated. You lose fluid while breathing, sweating, and yes, even while sleeping. Your blood becomes thicker. Your arteries tighten. Your heart has to push harder just to keep things moving. And then, you suddenly stand up. You strain to urinate. Maybe you even hold your breath without realizing it. Now your blood pressure drops. Your brain gets less oxygen. Then it spikes. That swing, the drop, then the surge, can be enough to trigger a stroke, especially if your vessels are already stiff or narrowed. A study in The Lancet showed that stroke risk is highest in the early morning hours. Dehydration is a major reason why. Here's the problem. As we age, our thirst signal weakens. You may not feel thirsty, but that doesn't mean your body isn't dehydrated. And it's not just about comfort. According to research, drinking 300 to 500 milliliters of water first thing in the morning, just 10 to 17 ounces, can reduce orthostatic hypotension, a common cause of falls and fainting, by over 60%. So instead of waiting until after the bathroom, drink first. Keep a glass of water on your nightstand. Make it a habit. Before you even get out of bed, sip slowly. Let your body wake up gently. With hydration, not strain. Because rather than starting your day with thick blood and low pressure, you're giving your brain what it needs most: oxygen, circulation, and balance. A glass of water may not seem like much, but in the first 5 minutes of your day, it could be the single most powerful stroke prevention tool you have. Here's a question you probably haven't been asked by your doctor. When you pee in the morning, do you feel like you've fully emptied your bladder? Most people say yes, but after age 65, that confidence may not match reality. As we get older, the bladder muscle, called the detrusor, weakens. For many seniors, it loses up to 50% of its strength. That means even when you think you're finished, there's often urine left behind. And holding that leftover urine may seem harmless, but it isn't. Studies show that incomplete bladder emptying keeps your body in a state of low-grade stress. It activates your sympathetic nervous system, the same system that kicks in when you're anxious or in danger. That response raises your blood pressure. It tightens your arteries. It reduces oxygen flow to the brain. Over time, this can lead to arterial stiffness, plaque instability, and a higher risk of stroke. One review, published in European Neurology, confirmed that post-void urine retention is common among older adults and dangerously underdiagnosed. But the danger doesn't stop there. When urine sits in the bladder too long, your kidneys work harder to manage pressure and fluid. This activates the renin-angiotensin system, a chemical cascade that can drive blood pressure even higher and accelerate vascular aging. It's like running a pressure cooker every morning without realizing it. So what should you do instead? Practice what's called double voiding. After you finish urinating, pause. Wait 10 to 15 seconds. Then try to go again. This simple technique can reduce bladder pressure by up to 60%, according to the National Institute on Aging. If you're male and dealing with an enlarged prostate, talk to your doctor about alpha blockers. These medications help relax bladder muscles and improve flow. If you're female, especially post-menopause, pelvic floor exercises can strengthen the muscles that help with complete emptying. Because rather than rushing out of the bathroom thinking you're done, you're giving your body a second chance to reset and protect your brain in the process. It's not just about comfort. It's about safety. Every drop you leave behind could be adding silent pressure you don't need. Let's talk about something that might feel a little uncomfortable, but it's absolutely critical. Have you ever had to strain while going to the bathroom? Maybe you held your breath, pushed hard, just to get things moving. That act has a name. It's called the Valsalva maneuver. And for seniors, it's not just uncomfortable, it's dangerous. Here's what happens inside your body when you bear down like that. First, you hold your breath. That traps pressure inside your chest. It reduces the blood returning to your heart. For a moment, your brain gets less oxygen. Then, when you release, the pressure rebounds. Your blood pressure surges, sometimes by 50, 60, even 70 millimeters of mercury in seconds. A younger, flexible artery can handle that. But for older adults with stiffened vessels or plaque buildup, that sudden spike can be catastrophic. A study published in Stroke, the Journal of the American Heart Association, found that intense straining during bowel movements increases the risk of a hemorrhagic stroke, bleeding in the brain, by over 300%. That's not theory. That's reality. And sadly, it happens more than we realize. You've heard the stories. Elvis Presley, found collapsed in the bathroom. And he's not the only one. Many seniors suffer strokes during bowel movements, and families never hear the full cause. It's too private, too painful. But it's preventable. So how do you fix it? First, improve the position. Sitting at a 90-degree angle kinks your colon. You're working against gravity. But if you raise your feet, using a small footstool or squat position, you open the passage. You reduce the need to push. Second, soften the stool. Add fiber to your diet. Chia seeds, oats, prunes. Stay hydrated. A study from the University of Iowa showed that prunes alone improved regularity by up to 60%. And finally, move. A 10-minute walk in the morning wakes up your digestive system. It gets things flowing naturally, because instead of pushing hard and risking a pressure surge, you're letting your body do what it was designed to do, with less force and more ease. Don't ignore the strain. Don't brush it off as just aging. Every breath you hold in that moment could be building up to something you'll never walk away from. Now, we've come to the most dangerous habit of all. And the truth is, almost every senior does it without knowing. It's not about what you eat, or how you sit. It's how you breathe, or don't breathe. Think back to this morning. Did you hold your breath while wiping? Or when standing up from the toilet? Even for just a second? That reflex, called breath holding during effort, seems harmless. But inside your body, it sets off a dangerous chain reaction. When you hold your breath and brace, pressure builds inside your chest. This immediately reduces blood returning to your heart. Your brain gets less oxygen. Then, as you release, your blood pressure spikes, fast and hard. That sudden surge can hit as high as 90 millimeters of mercury. In a younger person, it's a spike. In an older person, it's a bomb. And it doesn't stop with wiping. Many seniors hold their breath when reaching, balancing, or rising from the toilet, especially if their legs feel weak. But instead of protecting your body, this breath hold starves your brain. And when combined with orthostatic hypotension, a drop in blood pressure upon standing, it creates the perfect storm. A study from the British Journal of General Practice found that seniors who stood quickly from the toilet were 2.5 times more likely to experience vascular collapse or stroke symptoms. Why? Because their brains were hit with too little oxygen, followed by too much pressure, too fast. So what's the fix? Start by retraining your breath. Inhale deeply before you move. Then exhale as you stand or reach. Never clench. Never brace. Second, rise slowly. Don't rush. Place your hands on your thighs. Pause. Then move. That simple pause gives your brain time to adjust. And if you feel dizzy, lightheaded, or your vision narrows, sit back down. Those aren't small signs. They're warnings. Lastly, consider safety tools. A raised toilet seat, grab bars, a steady rail. These aren't signs of weakness. They're insurance for your brain. Because instead of bracing against the pain, you're moving with awareness. You're breathing through the moment. You're protecting the one thing you can't afford to lose, your independence. One breath, one habit, one change. That's all it takes to turn a silent threat into a safe routine. So now you've seen them, all 7 habits. And none of them sound dramatic on their own. Brushing teeth, sitting a little longer, standing up fast. These are things we all do, every day, without a second thought. But when you're over 60, the rules change. Your body responds differently. Pressure builds faster. Oxygen flows slower. Tiny actions that once felt harmless now carry real, measurable risk. That's why stroke doesn't always strike during high stress or after a bad meal. Sometimes it happens right after a morning routine, because of habits you didn't even know were dangerous. But here's the good news. Now you do know. And knowing gives you power. Instead of brushing only once, brush before bed and protect your arteries. Instead of sitting with your phone, move with purpose. Instead of rushing to the toilet dehydrated, hydrate first. And most important of all, breathe. Breathe before you stand. Breathe as you move. Because the single biggest thing your brain needs isn't a pill. It's oxygen, delivered safely and steadily. Stroke doesn't wait for warnings. It strikes in silence. But by changing these small routines, you're not just making your bathroom safer. You're protecting your brain, your body, your future. So the next time you reach for the toilet paper or feel yourself about to push, pause, breathe, adjust. Because you're not just going through the motions, you're making life-saving choices, right there in the room you visit most. Before you go, let me ask you something personal. Have you ever felt lightheaded after standing from the toilet? A wave of dizziness? A moment of blurred vision? Maybe even a ringing in your ears? Most people brush that off. I just got up too fast, they say. It's just aging. But now you know, it could be more than that. It could be your body sending an early warning sign. So don't keep it to yourself. Share your experience in the comments. If you've ever had a moment like that, speak up. Your story might help someone else realize they're not alone, and maybe even prevent a stroke before it happens. And if this video helped you, pass it on. A friend, a parent, a neighbor, someone you care about who's over 60 and might not know how dangerous a normal morning can be. Because instead of silence, we can spread awareness. Instead of fear, we can take action. And instead of losing another life to something preventable, we can speak up, change habits, and protect what matters most. Thanks for watching. Stay safe, stay steady, and we'll see you in the next video.